everyone, welcome to Study Ayurveda. Today we are going to talk about the vitiligo and its Ayurvedic management. What is vitiligo? Let's see about vitiligo. Vitiligo is a long-term dermatological disorder which is characterized by patches of the skin losing their pigment. Proper melanin synthesis into the melanocyte cells is responsible or it is essential for the normal color of the skin. The patches of the affected skin becomes white and hairs from the affected skin may also become white. This results in the destruction or hypofunctioning of the melanocyte. Vitiligo is a hypopigmentation of the skin. It is also called as hypomelanosis condition of the skin. What are the causes for vitiligo? According to modern medicine, the cause of vitiligo is unknown till date. It may onset at any age, but usually in childhood at 10 years of age or in second decade of life. It is multifactorial disease. Genetic susceptibility is important factor in this case. Risk factors are positive family history, suffering from inflammatory diseases, or autoimmune diseases. Chikitsa of switra. The principle of treatment are mainly in three folds, as explained in Ayurveda. First one is Nidana parivarjana, second one is apakarshana, third one is Prakurti Vighatana. Chikitsa of switra. The general line of kushta also can adopt in this condition, that is, raktamokshana is to be done at every 6 months. Virechana is to be done at every month. Vamana is to be done at every 15th day respectively. So it is because in the chronic state where bahudoshas are there and it is long-standing disease condition, it is having many more complications. So it is asadhya or incurable in nature. Then we are prescribing the patient to go for the raktamokshana on every 6 months. And virechana should be given for every month by using the sukha virechika dravyas like avipattikara churnam and trivrtavaleha can be given, and vamana is to be given at every 15th day respectively based on the dosha predominance, based on the avastha of the disease and the conditions which are involved, and also the bala of the patient is also important here. Based on depending on all the conditions of the patient as well as the disease, we are going to decide the raktamokshana, virechana and vamana. And it is not given for every patient. In chronic and untreatable conditions, it is given. Nidana parivarjana. The factors which are responsible for the disease, it is the fact that viruddhahara is the main cause of switra. So the first step is to avoid the nidana. So that is viruddhahara, ajina bhojana, vishamashanam. In detail explanation regarding the nidhanas which are responsible for the manifestation of switra have been explained in the Switra Kushta. You can go and check in the description link below. Second one is the apakarshana. Apakarshana is removal of the krimi from the body. Okay. Shodhana. The treatment should be started with snehapana with tiktakagrita, mahatiktakagrita for the period of 3, 5 or 7 days based on the kushta and agni of the person. Okay. After that, the svedana is applied, and this procedure liquefies the doshas which are present from the shakha, which are present in the shakha. It makes the doshas to get liquefied, that is pitta and kapha, which makes them ready to expel out from the body. Okay, virechana is a line of treatment for pittaja and raktaja vadi, and the involvement of rakta pitta are very clear in switra. Next, after virechana, the vata dosha increases in koshta, so it is necessary to give the snehapana. So what are the procedures we are following here is, first snehapana is given, followed by svedana, the one which liquefies the pitta and kapha and makes it ready to expel out. Next is the virechana is done. Virechana is done for the treatment of pitta and raktaja vadi. Here mainly there is an involvement of pitta and rakta. If there is an involvement of pitta as well as kapha along with rakta, then we are going for the vamana, and there is a utkleshita avastha if present If the dosha utleshita avastha is present, then only we are going for the vamana. Otherwise, we are going for the virechana. After virechana, the vata dosha increases in the kushta, so it is necessary to give the snehapana again. Second one is the raktamokshana. Raktamokshana should be preceded by shodhana and virukshana. After that, after shodhana and virukshana, we are following the siravedana procedure. It should be applied on the fused lesions and it requires a surgical skill. If the number of patches is more and appear all over the body, then siraveda should be done. If the patches are small and less in number, then pachanna is indicated. So, third one is the kshara prayoga. The conditions where Rakta Mokshana is completely contraindicated, Kshara is to be beneficial. So Falasha Kshara with the Phanita, it is beneficial in these conditions because in the hypopigmented areas, we are going to apply the Paniya Kshara. This Paniya Kshara is helpful for the pigmentation in that hypopigmented areas. Prakurti Vighatana. Here, it is making the environment unsuitable for that disease or for that microorganisms. It is making the body unsuitable for that to live. Mainly the tikta rasatmaka dravyas, khatu rasatmaka dravyas, tikshna gunatmaka dravyas, ushna gunatmaka dravyas, by intake of all these things makes the body unsuitable to live for those microorganisms. And externally the lepana is done. Lepa should be applied after the completion of the Shodhana as well as the Rakta Mokshana. First one is Manashila, Vidanga, Kasisa, Gorochana, Kanakapushpi and Sainavalavana should be made in the form of a paste and should be applied at the affected area. Kadali with Karasi Basma is mixed with the blood of cow. Hastimada along with the Malati Koraka Kshara is applied at the affected area. Nilotpala, Kushta, Saindava with Hasti Mutra is used. Mulaka Bija, Avalguja with Gomutra is applied. Kaka Udambara or Avalguja Chitraka with Gomutra is applied. Manashila with Mayurapitta. Avalguja Bija, Laksha, Gopitta, two types of Anjana, Pippali, Kalaloha Raja. Shodhana Lepa, which is explained by Sushruta Chikitsa Sthana 9th chapter and 6th shloka has been used. So all these dravyas which has been explained here, they are kshara gunatmaka because gomutra, hasti mutra and next or rest of the things are kshara only. So because of its kshara guna, it is working on the hypopigmented areas and it does the production of the melanocytes which leads to the production of the pigmentation over the hypopigmented area. So it will be very beneficial. Before going for any of the treatment or any of the suggestion, go for the authentic Ayurvedic doctor and consult them. After consultations, after the advices which are given by the Ayurvedic doctor, you have to follow those and follow the proper treatment regimen. We are getting the results of this switra within 6 months and up to year. It will get a result by proper following of the patya and apatya and with the proper following of the procedures and the regimens by the patient.